What you need to know prior to transurethral needle ablation of the prostate for benign prostatic hyperplasia. BPH, or benign prostatic hyperplasia, is a term that describes the non-cancerous growth of the prostate that can result in the blockage of the urinary tract and result in changes in urinary symptoms such as frequent urination, urgent urination, a slow stream, and incomplete bladder emptying. Minimally invasive therapies are procedures that are done through telescopes or catheters that either vaporize tissue or scrape tissue to create a larger passage for urine to flow through. Photoselective vaporization of the prostate, or green light laser, uses a laser fiber to vaporize tissue. TURP, or transurethral resection of the prostate, uses an instrument which scrapes the tissue out to widen the channel. Transurethral microwave thermotherapy uses a catheter to heat the prostate, causing it to involute over time. And TUNA, or transurethral needle ablation, uses an instrument or telescope to apply microwave energy to the prostate to result in the destruction of prostate tissue. Urinary symptoms that are not adequately controlled with medication or as an alternative to long-term medication are indications for a minimally invasive prostate procedure. Patients that experience urinary retention, recurrent urinary tract infections, or recurrent blood in the urine as a result of BPH also should consider therapy. TUNA, or transurethral needle ablation, is a procedure done through a cystoscope where an instrument inserts needle-like projections into the prostate to deliver microwave energy. The net effect is to reduce obstructing tissue and possibly diminish inappropriate nerve signals. There are a number of alternatives to TUNA: medical therapy, transurethral resection of the prostate, photoselective vaporization of the prostate, transurethral thermotherapy, as well as other laser procedures with the holmium laser or open prostate surgery, which is usually reserved for extremely large prostates. Serious long-term complications and side effects are less likely with laser surgery than traditional TURP, but could include the inability to urinate requiring a catheter, bleeding, narrowing of the channel or scar tissue, retrograde ejaculation, erectile dysfunction, injury to the bladder or the ureters, urinary incontinence, or persistent lower urinary tract symptoms that may require additional therapy. But there are some strong advantages of TUNA. It can be performed under just sedation. It can be performed as an outpatient, and there's a lower incidence of retrograde ejaculation and less of a need for catheter post-procedure. Since the procedure is done under anesthesia, you will need to fast starting the night before the procedure. Certain medicines like blood thinners may need to be held several days before the procedure. A preoperative exam and tests with blood work and EKG are usually required and to be done by your primary care physician. You will need a ride home from the procedure, and a responsible adult needs to be available for the first night after the procedure. The procedure is usually performed in the outpatient surgical center that's located either adjacent to your doctor's office or in close proximity. These centers are specifically designed for outpatient procedures. Some patients may need their procedure performed in a hospital, usually due to underlying medical conditions. The patient is brought into the procedure room and placed in lithotomy position. Anesthesia will be administered by a board-certified anesthesiologist, and an ultrasound will be placed through the rectum to provide additional local anesthesia. A cystoscope is introduced through the urethra into the bladder, and the obstructing prostate tissue is treated with microwave energy. The procedure usually takes 30 to 60 minutes, and at the end, a catheter will be placed in the bladder. Instructions on catheter care, usually only needed for one night, will be provided. The catheter will be attached to a leg bag, and patients will receive a larger bag to use during the evening. This catheter will be kept in place for 1 to 2 days after the procedure to prevent immediate post-op swelling. You may notice blood in the urine for up to 6 weeks following the procedure, but if there is worsening bleeding, clots, or difficulty urinating, please contact your doctor. You may pass tissue with urination, and this is very normal. Irritating urinary symptoms such as the constant need to urinate, intermittent burning, and more frequent voiding can occur and last for several weeks to months depending on the healing process and the size of the prostate. Sometimes difficulty holding the urine can occur for the first few weeks, but this usually improves over time. Post-procedure, no strenuous activities such as lifting or exercise or intercourse should happen within the first couple weeks following the procedure. Continue taking your prescribed prostate medicine and your antibiotic. The doctor will provide a prescription for an antibiotic to typically take for 24 hours. Some physicians prescribe medications to help with burning with urination, like Pyridium or Urel. Doctors will also recommend a stool softener if a pain medication is used. Please call your doctor if you develop a fever greater than 101.5, have chills, or severe pain. If you have nausea, vomiting, inability to urinate, or a significant amount of blood in the urine causing clots with lightheadedness or dizziness, please either call 911 or call your doctor. The pre-authorization process is essential. We will communicate with your insurance to determine your coverage and any co-payments or deductibles that might be owed. We will provide you with an estimate of any charges that you may incur. All charges are due prior to the procedure and payment plans are available. A surgical scheduler will give you a date for your procedure. You may need medical clearance with your PCP or internist, including a history and physical exam, as well as additional tests like blood work, EKG, and chest x-ray. You will receive a letter with all of this information and where and when to report. You can have clear liquids, but nothing to eat or drink after midnight. The hospital or one of our nurses will call and discuss with you the medicines you can take the morning prior to surgery. If you are taking a blood thinner like aspirin, Plavix, Coumadin, Xarelto, or Eliquis, please let your surgeon know, as they will likely need to take special precautions. But remember, never stop these medicines without a discussion with your primary care physician. Please arrive early for your procedure, usually at least 1 hour before the scheduled time. We hope that your procedure goes well and that you have a speedy recovery. We appreciate your feedback regarding your procedure, as we are always trying to improve the care that we provide to our patients. Should you have any questions regarding your procedure or recovery, please contact your doctor's office. Thank you.